Wellness for Life is brought to you by Perm Physical Therapy, Gothenburg Chiropractic Clinic, Mahabi Atwa Community Action Partnership, and Lakeside Sports and Pain Clinic.
Hi, I'm Dr. Mark Wheaton, physician owner of Lakeside Sports and Pain Clinic, and today we are going to be talking about elbow and wrist problems. Today we have with us a patient who has had chronic pain in her elbows and wrist dating back to the last probably 2 years. And being that she's young, she's 17, her problems are not due to bone spurs or degenerative arthritis or things like that, which you normally see in an older population. What you usually see with a person of this age group, where it's a slow onset, is connective tissue problems. And when we talk about connective tissue insufficiency, we're really dealing with ligaments and tendons. So background on her is that she's been a very accomplished piano player for the last 5 years, and in fact her future is in college right now with music education coming up this coming year. So what I'm going to do here, if you'll direct your attention to her elbow first, I'm just going to examine it. And what I usually do is I usually go through a range of motion such as you see here, just to make sure there's nothing blocking the motion. And once I've done that, I feel if there's any crepitus or clicks or pops or things like that. Next thing I do is I will do some simple testing. So she can grab my hand. Now you turn your palm down just to see if there's any pain or weakness there, and then turn the palm up again. Okay, very good. Now the key part of the examination is to test the structures in and around the joint. Now I always like to say that my MRI is my thumb because it's my reproducibility instrument. And what I mean by that is that I can reproduce the pain or the problem by simply pressing with my thumb into the areas where the attachments of the tendons and the ligaments are. And I'll show you in a moment the diagram which indicates where the ligaments are located. So I go through that process and find out where that ropiness is, the tension in the muscle, which indicates a deeper problem. Okay, right here we see a diagram of the bones that make up the elbow, and what I want to draw your attention to are the ligaments. That's this fibrous looking tissue right in here. This ligament right here is extremely important for supporting the structures of the elbow. It's called the annular ligament, and this ligament is vital to for elbow stability and for many functional activities, whether it's sports or in this case piano. Now if we move down to the wrist, being that her problem has been both elbow and wrist, I'll do a maneuver that would help test the stability of the ligaments. So looking to see if there's a lot of excess motion. And then I'll run it through a short range of motion again to see if everything's free. And then I'll do individual bones. There are 8 bones in the wrist. And after I feel those, then I palpate each one individually with a little pressure. And the patient will typically feel some degree of pain when I'm putting thumb pressure on the joint ligaments. So once I've done that, now we're set to take a look at the inside of the elbow. And that's a problem for which we can check here on the medial side, it's called, and this being the lateral side. Now many people are familiar with the term tennis elbow, and the tennis elbow is the part that's located on this outside of the elbow. So this is commonly referred to golfer's elbow. Now they're very generic terms, and what usually is the case is that a person with tennis elbow has this consistent pain in their elbow which goes all the way down to their wrist, and in the case of the wrist, problems that most often are encountered are carpal tunnel syndrome. This is also a very general term, and so I like to get really specific when I examine patients. So what I usually do for the problems that we've just described, and which I've been doing for this patient for the past couple years, is then take a solution which is a natural solution and The technique is called Prolotherapy. Now, Prolotherapy has been around for many decades, and it's simply a way of stimulating repair of these injured connective tissues. So I will just take a syringe with a small needle on it and just peppering meaning I'm just going in and out, and it just takes about 30 seconds here and then 30 seconds here, and I've covered the entire ligament structure. And what that does is start the healing process, and within a few short treatments and a few short months, there can be tremendous resolution of the problem. In her case, it has allowed her to continue playing at a very consistent level to accomplish her goals. So prolotherapy is a great treatment solution for these connective tissue problems that can cause a resolution in the problem permanently. So I would advise any of you who have this kinds of problems with your elbows or wrists, or frankly anywhere in your body, to call Lakeside Sports and Pain Clinic. The number is 952-593-0500, 952-593-0500. Or check out the website drmarkwheaton.com to get more information and check to see if you're a candidate for this process. Thanks.
Thank you for watching Wellness for Life. Brought to you by Perham Physical Therapy, Gothenburg Chiropractic Clinic, Mahabi Atwa Community Action Partnership, and Lakeside Sports and Pain Clinic.